So you're starting ADHD medication. It's a significant step, and it raises many questions. This video covers what you should expect during those first 4 weeks. You have the prescription from your GP. What happens next? You're probably wondering what's normal, what you're supposed to feel, and what you should be looking out for. We're going to break down that entire first month, so you know what's coming. This whole first month is built around a process called titration. Don't let the word scare you. It's a standard, careful method. Understanding it is the key to a successful start. The philosophy behind titration is simple. Start low and go slow. The process is about precision and patience. What this means is that you and your GP are working together to find the right dose for you. This is not a one-size-fits-all situation. They'll start you on a low dose and then, based entirely on your feedback, make small, gradual adjustments. The goal is not just to find a dose that works. The real goal is to find the lowest possible dose that gives you symptom relief while keeping side effects as minimal as possible. It's a balancing act. Look at these starting doses. Whether it's 30 milligrams of Vyvanse or 5 milligrams of Ritalin, these are intentionally small amounts. They're designed to see how your body responds. This isn't the final dose, it's the first step. So how does this play out in practice? Let's go through the timeline for your first month. The month breaks down into 4 distinct phases. Week 1 is about getting a baseline. Week 2 is for adjustments. Week 3 is about refining the dose. And week 4 is a full assessment of how everything is going. In that first week, you'll probably notice a few things. A dip in your appetite, especially around lunchtime, is very common. You might also get a dry mouth or a mild headache as your body adjusts to the medication. On the positive side, some people say that even on this small starting dose, they feel a sense of calm, like their brain is a bit quieter. This is the most important thing to remember for that first week. If you feel absolutely no benefit, do not worry. That is completely normal. It's expected. The goal at this stage is not symptom relief. It's to see how you tolerate the medication before your GP considers any increase. As you move into weeks 2, 3, and 4, things start to shift. Those initial side effects like headaches usually fade. You'll get a better feel for how long the medication lasts and when it's wearing off. Based on what you tell your doctor, they might increase the dose. You might also notice something called rebound, a dip in your mood as the dose wears off. All of this is valuable information. A practical tip: keep a daily log. It doesn't have to be detailed, just a few quick notes. When you took your dose, how long you felt it worked, and any side effects. This log is very valuable for your GP. It gives them the exact data they need to make the right adjustments. All this logging and feedback leads to one thing: finding the right balance. That optimal dose. If you're feeling anxious about whether this will work, the data shows that 70 to 80% of adults with ADHD respond well to at least one of these medications. The odds are in your favor. But what does working actually mean? How do you and your doctor measure success? You're looking for specific, tangible results. At your follow-up appointments, be ready to talk specifics.